As vaccines are protecting more lives, governments across Europe are starting to approach COVID-19 as a chronic but manageable threat. France has lifted most of its indoor restrictions last week, even though the health minister is warning of a fourth wave. Greece, you're aware, welcoming tourists. Masks are no longer mandatory in Hungary. And Germany is to allow vaccinated travellers from the UK, Portugal and a few other countries to enter without quarantine. Other countries are proceeding cautiously. In Ireland, they've postponed the return of indoor dining at restaurants, while Norway is delaying full reopening until at least next month. Whilst in Spain, Catalonia has reintroduced, or is reintroducing nightclub restrictions in response to a sharp rise in cases. Dr. Hans Kluge is the regional director for Europe at the World Health Organization. He's with me via Skype from Belgium. Doctor, thank you. What we are now seeing, and particularly from the UK, is a statement, some would say of the obvious and the reality, that we have to live with COVID and therefore we need to treat it as a chronic disease, which will accept more cases but lower deaths and serious health injuries because of vaccinations.
I would say, Richard, that we passed that bridge, because after a 10-week consecutive decrease in trends of COVID-19, unfortunately, last week we have seen a 10% increase. We were always thinking about the resurgence by the fall or the winter. Now we're thinking about the resurgence before, because the three factors for a resurgence are in place. There is lifting of social restrictions, there is a fast spread of the Delta variant, and still, from a pan-European perspective, a deficit in vaccine uptake.
Do you think the governments are lifting too many restrictions too quickly?
Generically speaking, any uncontrolled ground opening to unleash mobility is not the time to do so. But if your public health system can quickly detect outbreaks and mitigate it, that's another issue. But if we speak about large gatherings, where people particularly are gathering without masks in an epidemiologic situation where the caseload is increasing, then it's not time to go for more and more, let's say, loosening of restrictions. Right. But I do understand that no one wants to give up another summer, but no one, Richard, wants to lose another relocked winter neither.
Okay, but the Israeli government, for instance, says the overall efficacy rate of the Delta, of vaccines against the Delta variant is not as great. The Pfizer vaccine is much lower when challenged by Delta, down at 64%. It remains highly effective against severe disease at 93%. We don't know how or the wheres and whats. So this idea that the Delta variant can get through Pfizer, but Pfizer still prevents the worst effects. Isn't that how we're going to have to live our lives?
Well, you have a good point, Richard. So what's the main objective of the vaccination? It is to decrease the severe diseases, hospitalizations, so our health systems don't collapse, and deaths. But basically the Delta variant unmasks the Achilles heel of Europe. Only 24% from a regional perspective is vaccinated. Half of the elderly, 40% of the healthcare workers are still unprotected in a context of increased summer mobility. And that's why I repeat three messages. If you decide to travel and to gather, do it safely, number one. Number two, if it's your turn, take the jab, don't doubt, but take it 2 times, because the Delta variant doesn't really break through a second dose. And third, let's get finally the vaccines to those who need it most, based on solidarity.
As I understand you right, this idea of returning to some normality, I don't want to be depressing about it, but it's just not going to happen. I mean, I'm here in New York where life is pretty much normal. The Delta vaccine, the Delta variant, when it gets here in any large numbers, one hopes that sufficient people are vaccinated that it won't have dramatic effects on the healthcare system. But you're saying by the time we get to winter, we could be not back to square one, but still in a pretty bad way.
Definitely, we're not out of the woods, but I'm also an optimist. So what we need basically, Richard, is I call it VIP approach, the V from variants. Scale up genomic sequencing, and we're getting much more better in this. The I from immunization to scale up the vaccination and really decrease vaccine hesitancy. And the third one is the P of the people. We need civil responsibility. In a nutshell, we need civil responsibility and political decisiveness.
Doctor, we will talk more, because there's one thing we're certain: as these policies happen, we will see the effects within days, well, so within weeks. Thank you, sir.